The peer support part of Capital is obviously really what Capital's all about. So we are peers, so we all have lived experience. So we really work in peer support. More recently, we've lost some of our commissioning around the peer support in our inpatient wards in the hospitals. And that's actually really devastating because I know that's a really valuable service to actually get to speak to somebody in hospital that's not in uniform, that looks like you, that really identifies with, you know, who you are, has been sort of similarly walked in your shoes. I think that's so important that we are in those acute wards. And unfortunately, that part of Capital will be going soon. As far as I'm aware, we're really trying to save that part, but that's all down to commissioning and how things are going in West Sussex. Things are really uncertain in mental health. But aside from that, we also do peer support in the community, and that's something we're going to move towards more. You know, if we can't be in the inpatient hospitals, and I think people have even said they'd even volunteer their time. At the moment, we're big on paying for peer support. What we don't want to do is that everyone, oh, we're a peer, we don't need to get paid for that work. We really think that peers deserve to be paid, and we really value, you know, can't think of the word volley for that. Is the word really volley for them to get them paid, and we always have done. But people have said, you know, if the money's not there, but absolutely we'll go into the community because we really want to help people. That's what people at Capital are like. So I think there'll be a lot of that going forward while we're waiting to build on our funds. I think we'll find that people will be helping, and to run the groups that we run in the community. We run a lot. We've got them in Crawley, East Grinstead, Bognor Regis. They run all over West Sussex, and we'd like to do more of it. And we'd actually like to really sort of do some more specialist groups in the community. Really, you know, maybe a men's group would be good. We really identify there's lots of men that need help at the moment. You know, I'm in the Bognor area, and I know there's a real need for groups in the community at the moment. And we know that there's a mental health crisis. You know, mental health's getting worse. Yet there's big funding cuts at the moment right now, so we have to really do what we can to kind of help people in our community, and that's what the peers really want to do, and that's the power of peer support, is they just want to be helping others. And to be fair, it really helps them too. Peer support is a two-way thing, so you know, by helping others, you know, it automatically makes you feel better. It shows peer leadership. You know, people are just building together. So yeah, so it's a real shame if we have to see some of the peer support work go in West Sussex. Yeah, I think the impact of losing the peer support service will not only be devastating, like I say, to patients, particularly in our inpatient wards. You know, if we lose that service, that would be devastating to them. It'll be equally as devastating to the peers. We have a lot of peer support workers across those three hospitals. Some of them have worked for us for years and years. I think one of our peer support workers, might have to quote me on this, I think she said she's been there only 20 years. So, you know, Capital's been going for 30. They're really invested in their work, and they will be devastated. They won't be able to find a job the same. You know, like I say, the way that we understand each other's mental health. You know, our CEO Duncan's great as well. He really gets it. He really understands. You can go to Duncan and say, you know, I'm not having a great day, and he will really understand. And you don't always get that with an organisation. So I think not only is it devastating for the patients, devastating we have to lose some of the community drop-ins, but also devastating for the peers that are doing that work. It'd be a massive for them to have to lose their jobs, especially it's just before Christmas. Let's face it, that's not great either. So Capital going forward, if we can go forward, we're a very, very small team, and we were small anyway. I mean, I think people think we're a lot bigger than we are because we do a lot of work, and we try to shout out and get our name known in West Sussex and get into as many meetings as we can and really get our voices heard. But actually, we've always been a small team. And we had, I think it's, Duncan will quote me on this if I'm wrong, but I think it was 81% in cuts or something. But it basically means our team's going to be tiny, and most of the staff will be leaving, and most of them are peer support workers.